Hi, I'm Nurse Barb, and this is your daily dose on IUDs and how they work. Today we're going to talk about the progesterone-containing IUDs and how is it that they work to prevent pregnancy. Well, IUD stands for intrauterine device, and I have a model of one here, although this one has never been used in someone's body and they're not green. This is a 7-year progesterone-containing IUD, and it has about 52 milligrams of levonorgestrel, which is a type of progesterone. Well, how does this work to prevent pregnancy? I'm going to show you with my uterus model. So I brought this for you today. So this is a uterus model, and it's about the right size. Our uteruses are about the size of our fist. And what you see here is on the top, this is called the fundus. These are the fallopian tubes. And on either side, you have an ovary. Here's the vagina. Well, this handy dandy model has magnets. So when I take it apart, you can see what's going on inside. So this is typically what the uterine lining looks like. And we'll just use this one for now. So in the uterus, you have a muscle on the outside and you have a uterine lining. And what's really important with the IUD is right here, this is the cervix. Because when an IUD is inserted, and when we insert it, and I'm going to tell you more about that in a minute, it sits in here, inside the uterus, just kind of like that. And when it sits in there, the progesterone that's inside that long neck there, it tells the cervical mucus to be really super thick and make a barrier so that sperm cannot get through. Now, if there's some really vigorous sperm and they happen to get through, what happens with the IUD is that progesterone is acting on the lining of the uterus and it makes it very, very thin and atrophic. That changes the pH and that changes the environment. So any hardy sperm that get through that super thick mucus barrier, well, they end up dying in here inside the uterus. They don't make it to the tube and they don't make it to an egg to fertilize it. What happens with this type of IUD that's good for 7 years and it has progesterone in it is it does not interfere with ovulation. So women who use this type of IUD, they still ovulate every month. But the sperm are either getting stuck here or they're dying here. They're not getting to the tube, so IUDs do not interfere with a fertilized egg. What happens with the IUD is that there's a string that's a medical grade string, and it's hard to see it, but it comes out of the cervix, and we typically wrap it around the cervix so partners don't feel it. We use the IUD for many, many different reasons. We use it for contraception, but I have many patients who have such heavy, terrible periods that they have so much pain that because this particular type of IUD that's good for 7 years typically causes about 40 to 60% of women, that's 4 to 6 out of 10 women, will not have a period. And that's because when the IUD is inside, it makes that lining so super thin that there's nothing that comes out. And women who do use this IUD, when it's in place, if they do have a period, that period tends to be very, very light. So what should you ask for when you see a provider about an IUD? Well, first of all, you want to see someone who does this all the time because the likelihood of any kind of serious side effect is really low. Personally, I put in between 1 and 4 IUDs in patients every day that I work. So I put in thousands of them. And I want to tell you some of the risks, but remember that these are very, very rare. Of course, anytime you are inserting anything into any body cavity, there's a chance that there could be an infection. There's also a chance that if someone's not really careful, that the instruments that we use could perforate or go through the uterus. Now, knock wood, never had that happen with any of my patients. And there's also a small chance that if a woman is very young, let's say she's under 18, never been pregnant, or has a very small uterus, that IUD can be expelled or come out. That happens about 2% of the time, and it's much more likely in younger women. So what do I tell my patients about IUDs? Well, if you're able to see a provider before you have an IUD inserted, it helps because then we can do an exam and see what your cervix looks like and see if it's a little bit open, and then easier to put the IUD in. When I see patients ahead of time, we go over all the benefits, all the risks, and what to expect. And one of the things that I do is if a woman comes in, I examine her, I look at her cervix. Now, I don't have a model of a cervix, but I'm gonna show you what cervixes pretty much look like this. And some of them have a very sort of tight, what we call stenotic opening. And so trying to get an IUD in here is really, really difficult. And so if a woman has never had a pregnancy or never delivered a baby, that opening to the cervix, we call that the os, that can be so tight that putting an IUD in could be really painful. So I like to see my patients ahead of time. And if they have a very tight stenotic cervical os, I recommend a medication that we can have a woman use prior to the procedure that helps slowly and gently dilate that cervical opening. The other thing that many providers do is ask women to come in during their period, because during their period, that cervical os, if it's really tight, it'll open up a little bit and make insertion easier. The other thing that I do, and what's also recommended, is that we use what's called a paracervical block, or some numbing medicine, which is very similar to what your dentist uses when you're having any kind of procedure like a cavity filled. Now, your dentist uses something like Novocaine or lidocaine, and here in our office, we also use a similar anesthetic agent that we put at the cervix so that women feel less pain. That makes the insertion so much easier and so much more comfortable for women. I know I do this because personally, I don't have a pain tolerance at all. I can't stand to have anything done that hurts. And so for many years, I've been using what's called a paracervical block when I insert an IUD. Now, what are some of the other things you have to know about IUDs? Well, they're called a LARC. That's L-A-R-C. That's a long-acting reversible contraception. So when an IUD is removed, fertility returns to normal immediately. I've had patients come in, have their IUD removed, and become pregnant within the next few days. Because this is completely reversible. Again, it's good for 7 years, and that's a recent guideline from the American College of OBGYNs and the FDA. They used to say that it was only good for 5 years, but now the data shows that it's still effective for 7 years. When a woman has an IUD in place, the likelihood of pregnancy is less than 1%. In fact, it's about 1 in 1,000 women who have an IUD in place will become pregnant. But if a woman has an IUD in place and she's one of those 1 in 1,000 who does become pregnant, there's a slightly higher chance that that could be a tubal pregnancy. And we think that's because having the IUD in the uterus prevents the fertilized egg from coming down into the uterus. And so it stays in the tube and causes what's known as an ectopic or tubal pregnancy. So if you have an IUD present and there's any chance that you could be pregnant, you're having any symptoms or any severe pain, do talk to your healthcare provider about it. When we put an IUD in, one of the things that most women are surprised to learn is that this little string that comes out, and I don't know if you can see that string, it's a little hard to see on this video, but when it comes out, we curl it around the cervix. And I typically curl it to either face 3 o'clock or 9 o'clock, and that way partners don't feel it. So we leave the string a little bit long and we curl it there so partners aren't bothered by it. So I hope this answers a lot of your questions about how IUDs work. And if you found this video helpful, please click on like and please subscribe. And also for more information about IUDs, you can go to my blog, nursebarb.com. Again, I hope this has been helpful. Take care and be well.